The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back. As you know, we make videos about health and healthcare topics, and all our videos are directly referenced from the International Medical Library from the US. So we have been getting a lot of requests on this topic. So today we are going to cover the curvature of the penis. Why that is the Peyronie's disease. Why do many people have a curved penis? So see, the curvature of the penis is basically a abnormal bend in the penis that occurs during erection, right? It occurs during erection. That's the thing, and the medical name is Peyronie's disease, and it is because of a scar tissue which basically develops in the deep tissues of the penis, and the cause of this scar tissue is not known, quite frankly, but it can occur spontaneously also, or it can also be due to a previous injury to the penis, even if that injury has occurred many years ago. So mostly injuries are basically associated, but many times it can occur without any reason. So fracture of the penis does happen, which is an injury during intercourse, or this can also lead to this condition, right? And some people, obviously those who have men who are at higher risk are the people who have had surgery or radiation treatment for prostate cancer. So if you have had any kind of issues with prostate, you can have Peyronie's disease. And quite frankly, Peyronie's disease is uncommon. It's not very common, but it does affect men from the age of 40 to 60 and even older commonly. And if you are sexually very active and you experiment a lot, then you might end up having injuries on your penis internally and lead to scars, right? So these curvatures can also occur with something called as Dupuytren's contracture. Now what is this? This is basically a cord-like thickening across the palm of one or both hands, right? It is a cord-like thickening, one or other. This is fairly common, Dupuytren's contracture, and this is common in people who are 50 years or older. However, only a very few number of people with Dupuytren's contracture develop curvature of the penis. Now these two things can have the tendency of having contracture in common. That's why having a contracture in the hand can lead to curved penis. One other risk factor which is there obviously are over enthusiastically masturbation, right? Meaning very harsh, very rough masturbation. That can lead to internal injuries and soft tissue injury and scarring. However, people with this curved penis have a certain type of immune cell marker. There is an immune cell marker which indicate that it might be inherited. That means it is genetic also, right? So and even newborns can have a curved penis, and this curved penis, and this may be a part of that abnormality called chordee, which is basically different from Peyronie's disease, and newborns having this problem is chordee. So what will happen when you have this symptom? See, obviously you will have a bend in the penis, which most often begins at the area where you feel the scar tissue. There you might feel the scar tissue, or even some kind of hardening that might be there, and there will be softening of the portion which is beyond the area of the scar. If the scar is here, the other area will be soft, that would be there, and there will be narrowing of the penis, there will be pain in the penis, and problems with penetration or even pain during intercourse can happen. and sometimes shortening of the penis can also happen. So these are the presenting symptoms. And about tests, basically the doctor urologist can actually diagnose the condition with just a physical exam, and very hard plaques can actually be felt with or without an erection also. Right, the doctor might give you a shot of medicine to actually cause an erection, right, something like a Viagra, sildenafil, right, Cialis, something like that, or your doctor may provide you with some pictures or stimulation to get the penis erected for examination, right. And even an ultrasound of the penis can be done, which might show the scar tissue. However, this test, ultrasound, is not necessary because it's little costly also. All right, and as far as the treatment goes, what is the treatment? At first you may not need any treatment, and many times the symptoms can improve over time and will not get worse. This can happen, so you might get relieved. But the treatments, when they are needed in certain cases, when you are having a lot of pain, when you are having a lot of discomfort, in that case treatments are given, like there are some injections which are given into the fibrous band in the penis, in the tissue, which are corticosteroid injections. Then a medicine is available, which is known as potaba is there. Radiation therapy can be done, shock wave therapy can be done for actually scar breakage, or there are injections which is basically Virapamil injection can be given, which is used to treat high blood pressure but seems to be working with this condition. And vitamin E is also given. So vitamin E and all these things are given. Then there is something called as a new injection which is coming up to actually treat the curvature, which is called as Xiaflex. Xiaflex is basically a collagenase Clostridium histolyticum. That's the name of it. So this is a new injection which is coming in the market. So you can talk about these treatment options with the urologist. However, see, not all these treatments are actually are very helpful, right? If at all, not all of these treatments help very much, quite frankly, in all the cases, right? Some people may get very good results, some may not get results, and some people can get more scarring, right, because of this. So you have to be under follow up, and you need to listen to your doctor. Then if the medicine and the lithotripsy, which is shockwave lithotripsy, does not work, then, and if you are unable to have an intercourse because of this, then surgery can be done to correct the problem. However, some types of surgery can also have complications. Even impotency can happen. So you should therefore you should only undergo surgery. Surgery should only be done if intercourse is impossible with this curved penis, right? So a penile prosthesis, there is something called as prosthesis, may be the best treatment for a curved penis, which might be the treatment of choice, and this is for with the people who are impotent, right? So the penile prosthesis is very good for them. So you can talk about this with your urologist as well, right? Because you're already impotent, so you don't need to impregnate the woman, right? That's the thing. So about the prognosis, the condition can get worse over time. It might lead to making you impossible to have an intercourse. Impotency can also occur if you don't get treatment. That is one thing. But when should you contact to a doctor? If you are having a symptoms because of the curvature of penis, that means your erections are painful, you are not getting any intercourse, you are not able to do intercourse, or if you are having a sharp pain during the intercourse, or followed by swelling and bruising of the penis, then you need to go to a urologist, right? So this is the information I have about curved penis. So I hope you enjoyed learned something new, and make sure to share this video with your friends. I'll see you tomorrow with a new topic. This is Dr. Paramjeet. Stay connected, stay healthy.